Now, for someone with RA, in addition to those same joint preservation strategies we teach for any kind of arthritis, patients with RA also need additional management to help reduce that inflammatory response. So remember, this is an autoimmune condition, so they're going to be prescribed DMARDs or biologics. DMARD stands for disease-modifying anti-rheumatic drug, so it modifies or slows the disease progression. And these are great drugs for that reason. The classic examples are methotrexate and etanercept, but they work by suppressing the immune response. That's what suppresses that autoimmune response. So these patients are going to be at high risk for infection. So of course, you're going to teach them hand hygiene to avoid crowded spaces, as well as reporting any sore throat or fever that they might have or signs of infection. And another star point to remember for the NCLEX is that these patients must test negative for tuberculosis before starting either of these drugs. Because if they have latent tuberculosis and we give them a pill to suppress their immune system, it's going to reactivate into active tuberculosis. So don't do that. And patients with RA also have fatigue, remember. So we need to teach them how to manage that fatigue and conserve their energy. So that's going to mean prioritizing their most important activities early in the day and sitting when they can for tasks like folding laundry or cutting up vegetables for dinner. And because that RA inflammation and stiffness gets worse with inactivity, we don't want them to develop contractures. So to prevent contractures, we're going to encourage range of motion activities and splinting joints so that they don't stay in that contracted position but are splinted in a neutral position. And remember that stiffness gets worse when they're inactive, like overnight. So we need to make sure they're sleeping in positions that aren't going to cause contractures. So it's okay for them to sleep with a small flat pillow under the head, but they should not have any pillows under their knees or they are going to wake up with contracted knees. So no pillows under the knees, under the head is okay.